Now we call upon Professor Praveen VASHIST for his concluding remarks.
Thank you, sir. In fact, the first thing I would like to mention is the special initiative by our president, Nepalia sir, that this year will be taken by AIOS as year for giving emphasis on low vision and rehabilitation. And thank you. I believe that all the Iconians should work together in this area and help maximum people as much as possible. And I believe most of the ophthalmologists specifically, they are not inclined towards working towards low vision area. And it may be sometimes difficult for optometrists to work in this area. So what we need is proper training and orientation for both the group together so that these services can be expanded all over the country. We have done a situation analysis and we got that hardly there at present there are 100 institutes which are providing low vision service in the entire country. And probably it is need that at least we should orient Ministry of Health and Family Welfare, the National Program Control Blindness, that at least they have something. I've seen NPC program, I'm dealing with that program throughout, and surprisingly, there is no word about low vision services in the entire program. I met Director General Health Services, and under his chairmanship, we had a meeting. We decided to have one task force for inclusion in eye care, where rehabilitation is an important component. And I request, especially our president, AIOS President Dr. Nepalia, that he should form a committee, a task force in AIOS also, which can work in low vision and rehabilitation. For the institute who are already providing services in low vision, I have one suggestion. Please add on rehabilitation services. In RP Center, with the support of CBM, what we are able to do is that we have a separate dedicated rehabilitation division. We call it now the Rehabilitation Training Center. And what we have done is we have developed collaboration with various agencies like all the school for blind, rehabilitation agencies, vocational training centers, nearly around 75, 76 centers are there which are working in field of rehabilitation. One hospital cannot do everything. What we need is to reach to have a collaboration with all the agencies, and it can be a very good mutual collaboration. They need workup for the low vision cases that hospital people can do it. And what we need is we need to refer such patient to the community for rehabilitation that they are already providing. So we are able to do it, and I feel very happy. Of course, Dr. Suraj Sanjam is not here right now. He has taken special interest in RP Center for this thing, and I am happy. I'm happy to promote him also. Other side, Sneha, which she presented, in fact, she is a key person in RP Center who is dealing with low vision cases. And you must have seen through her presentation what passion she had. Probably that was one lecture which was showing only the practical experience with us. So I expect such kind of initiative. I welcome, sir, from RP Center side, if any agency who require training in low vision rehabilitation, we shall be happy to provide training. I'm okay, Sneha. Sneha will be able to provide training to people. And of course, we have Professor Radhika Tandon as our chief. She'll be very happy. She is also working in the same area, in low vision area. So this is, I can commit from RP Center side, any institute require any kind of training, they are most welcome.
I agree with Professor